ऑलराइट, ये आप प्लीज ये जो ये बीप हो रहा है ये बंद कर सकते हैं?
मैम ये मेरे पास से तो नहीं हो रहा।
बार बार बीप क्यों हो रहा है? अच्छा खैर, स्टॉप, थैंक यू. ओके, सो अस्सलाम वालेकुम एवरीवन एंड good morning. I'm really sorry for this beeping sound. I don't know why it's beeping so much. So we're going to be talking about environmental trauma today. This is a pretty big lecture, and I would appreciate if you walk along with me till the end. And I'll try to get done with it as soon as possible and to be very concise about each and every topic. The main things that we need to talk about are mainly injuries and death from heat, cold, starvation, and electricity. All right, so let's begin. The first one would be, why is this in here? Okay. So the first ones being deaths or injuries. We're mainly talking about injuries from colds. What's happening? आप ये कुछ म्यूट कर सकते हैं क्योंकि ये तो बहुत ज्यादा बीप कर रहा है.
जी मैम.
मैं कह रही हूँ कुछ म्यूट कर दीजिए. ये जो पार्टिसिपेंट्स है सबको आप मीटिंग रूम में कर लें, वो वेटिंग रूम में है शायद, क्योंकि बहुत डिस्टरबेंस हो रही है. बच्चे भी क्या सुनेंगे.
जी मैंने कर दिया मैम.
कर दिए. ओके, चलिए, थैंक यू. ये सब म्यूट पे हैं बच्चे?
जी मैम.
किसी बच्चे की उससे आवाज ना आ रही हो? चलें,
नहीं,
ओके,
सब म्यूट है मैम.
चलें, ओके. अच्छा, so we were talking about deaths from cold. I'm sorry. ये क्या हो रहा है? अच्छा खैर, तो let's start with okay.
मैम ये आवाज आती रहेगी क्योंकि जो बच्चा
हाँ.
जितनी देर बाद लॉगिन करेगा वो आपको अलार्म देता रहेगा सिस्टम.
अच्छा,
तो आप स्टॉप ना है, आप कंटिन्यू करें.
चलिए मैं इसको एडमिट ऑल करके, ताकि वो एटलीस्ट आवाज बंद हो जाए. म्यूट ऑल. यस, ओके. उप्स, मैंने शायद अपना, ओके. अब आवाज सही आ रही है? आई होप वो बीप साउंड चली गई है. स्टूडेंट्स, कैन यू हेयर मी? ओके, आवाज नहीं आ रही है. Can you guys hear me now? Yes, all right. Oh my god, why don't you guys join in time? All right, so let's start. I'm really sorry for this beeping sound, but we'll have to go on with it because I don't think this is going to stop anywhere soon. So deaths or injuries from cold. The main effect of cold can be localized or generalized, and it depends upon the duration in which a body is exposed to cold environment or the amount of contact that it had. All right, so let's start with what happens when a body is exposed to cold. Now, our general mechanism of okay, our mechanism works in a way that it wants to, you know, oh my god, आज ये क्या हो रहा है? Our bodies work in a way, okay, they want to save their energy and they want to preserve their temperatures. All right, so when the outside environment gets very cold, our body tries to save up all the, I'm so sorry, voice is clear enough. Okay, all right, so all right. Acha. Then So it's just trying to preserve energy and maintain the body temperature. In an attempt to do so, our body lowers its metabolism, as a result of which the respiratory rate and the heart rate drops. All right. Now, in an attempt to maintain the core body temperature, what happens is that the peripheral circulation, like the blood that's going towards your arms and your legs, that uh, sort of gets lowered, or the peripheral circulation falls. All right. Uh, Another attempt to maintain the body temperature is vasospasm. All right. So it happens in peripherally, like in your arms, legs, nose, ears. Okay. All the peripheral areas gets low blood circulation due to vasospasm, and that leads to a pale body surface. Another thing that happens is that oxygen is not readily dissociated into the tissues. Now, why does this happen? This is mainly happening because of vasospasm. Due to vasospasm, there's blood stasis, right? The blood stasis causes capillary endothelial damage, all right? And that damage leads to a decrease in oxygen dissociation. Okay, I hope I'm making the chain clear. Your muscles can get stiffed and exposed body parts can become red. All right, this is a part of inflammation that's happening because of the extreme cold environment. Now, the marked line that is at which our body just shuts itself down and death occurs is 21 degrees centigrade. So bodies cannot survive, human bodies cannot survive below 21 degrees centigrade. So you should be remembering this temperature, 21 degrees. All right, so let's start with, now, the main damage that happens during extremely low temperatures is due to blood stasis. This is the main criminal in this entire scene, because what happens is when there's blood stasis, there would be thrombosis that would lead to a blockage in one of the vessels, and that would lead to tissue necrosis. Now, this thrombosis can occur in the brain, in the heart, in the peripheral areas like fingers, or anywhere. It can be anywhere, right? And if it happens in the heart or the brain or the lungs, obviously there would be instantaneous death, right? So, talking about low temperatures, let's define hypothermia. What it is? It is a condition in which the body temperature is less than 35 degrees centigrade. All right. So remember 35 degrees centigrade for hypothermia, right? And death is preceded by fatigue and drowsiness. All right, that's not important. So let's talk about the main injuries which can be seen during extreme cold exposures. Frostbite. You might have all heard about frostbite, right? Now, what exactly it is? It's just remember we talked about that blood stasis and then thrombosis happening, leading to tissue necrosis? That's exactly what it is, frostbite. But it only happens in the peripheral sites like fingers, toes, nails, ears, okay? All the peripheral exposed areas that are more prone to cold injuries because they're more exposed to the freezing environment. All right. So what happens is there would be thrombosis that would lead to an alteration in the blood supply to these peripheral areas, and ultimately necrosis. Okay, so it is classified as a freezing injury. Okay, frostbites only happen in extremely cold environments. Okay, so this is a classic picture for frostbite, and as you can see, all of the fingers have been deprived of their blood circulation, and that has led to an extreme amount of necrosis in all of these fingers, right? Okay, then that was the only freezing injury that we need to talk about. Then there is trench foot, which is just when remember Now I know you might have not experienced a trench foot, but if you just expose yourself to water for a long time, like for example you're swimming or you're taking a bath for a very long time, uh, have you ever noticed that your finger of this your palm's skin gets all wrinkly and swollen? So that's a starting of a trench foot, okay? A very subtle level of trench foot, I would say. So that's exactly the skin changes that we see in trench foot, but they're at a very severe degree, right? So it's a combination of cold environment along with moisture or water. Okay, so these are typically seen with soldiers who are walking in trenches. They're wearing long boots and they just have to walk underwater, and they get their moisture in their feet and it's cold, so they get their skin very wrinkly. This is how it looks like. All right, it's not just a wrinkled skin, there's ulceration, uh, there's itchiness, there's pain, there's loss of sensation as well if it's very severe. So there's a lot of happening, not just the wrinkly skin. Okay, so it would be classified as a non-freezing injury. Now, I'm really sorry, why is this coming up? Okay, then there's immersion foot. Oh my god, what's happening? Immersion foot. Now, this is immersion foot and trench foot. Both of them are the same thing, all right? But I don't know why in your textbook they have been classified differently. So that is why we are just talking about them differently. But classically speaking, an immersion foot and a trench foot, both of them are the same thing, right? So don't worry much about what's an immersion foot or what's a trench foot. They both are the same thing. What happens is that due to prolonged exposure to moisture or moisture environment with water or mud or whatever that is, your feet get exposed to cold, and then this is what happens to our skin. Okay. Oh my god. Achha. So let's start with now. Let's talk about hypothermia again. A body temperature of less than 35 degrees centigrade. Okay, 35 degrees Celsius. This is what you need to remember. 35 degrees Celsius is called hypothermia. Now, what are the diagnostic findings? Just remember, everything goes down or everything goes low. The body temperature goes low, so you would experience cold skin, there would be muscle stiffness, there would be a low pulse and a low blood pressure, okay, and there would be depressed reflexes, so everything is just going down. Low reflexes, low pulse, low BP, low body temperature, and the muscles are just not wanting to move, so their mobility goes low as well. All right. So now the good thing about hypothermia is that successful resuscitation is possible. Why? Because the metabolism in hypothermia is extremely low, right? So in an attempt to save ourselves, our body just lowers the metabolism rate. When there's a lower metabolic rate, the oxygen consumption of the body is very low. Okay, so I just you are the meeting host. You can mute this joining beep by changing its toggle in the meeting settings. Okay, I really didn't know that. Where are the meeting settings? Actually, I'm not the host. I'm really sorry. I'm not the host, but I'm not sure where should I mute this. क्योंकि मैंने भी पहले कभी नहीं इतनी beeping sound सुनी है. I don't know from where should I do this. I'm not the host. I'm really sorry, Muhammad. I cannot see your full name. I'm really sorry for this, but I'm not the host. And so, where were we? So let's talk about the treatment for. Oh my God, ये क्या हो रहा है ये? Okay, wait. Probably यहाँ से कहीं से हो रहा है. Mute all. No. All right. So for hypothermia, the treatment would involve gradual restoration of warmth. You need to maintain the pH and electrolyte balance or treat any inflammatory conditions. So mainly it's just symptomatic. You just need to get the body temperature right. All right. ये आज पता नहीं बहुत ज़्यादा irritate कर रहा है. So the main cause of death in hypothermia is when the body temperature reaches the borderline, that is 21 degrees centigrade, at which everything just ceases to function. The heart stops beating, the lungs stops pumping, taking in the air, everything just stops. Okay. Now, what would we see in a dead body who died of hypothermia? There would be red patches. There would be red patches that would be seen largely over elbows, hips, knees, the large joints mainly. Then you might see some local cold injuries like frostbites or immersion foot, because obviously there is hypothermia, so there might be some cold injuries as well. All right. And if the body was exposed to low temperatures for a very long time, there would be some gastric erosions or hepatic or pancreatic necrosis, right? Then comes the medical-legal aspect. So it can be seen in cases of homicide where someone's wanting to kill other. Oh my God. I'm really sorry. मुझे भी नहीं पता कि how should I just mute this beeping sound. All right. So for medical-legal aspects, just hold on, guys. Let me call the moderator. Maybe he can just help us out. Like it can be like hypothermia cases can be seen in cases of homicide, in cases of little children or extremely old age people that can be easily exposed to cold. And there might be some accidental deaths as well, right? Oh my God. Then there is a phenomenon that's called paradoxical undressing. This is seen in cases with hypothermia, and it's seen just before death is about to occur. Okay, so what happens is that there's rapid vasodilation. Now it's just a sign that your system's just giving up on things. Okay, remember we talked about that there's vasospasm when our body is exposed to cold. Remember? So that vasospasm just settles in and it just eases off, and then there's rapid vasodilation that leads to sweating, right? So the person would feel a bit warm and they would just try to take off their extra clothing to feel better, and that's what lowers the temperature further and death occurs. Okay? So this happens just immediately before death, that there's rapid vasodilation all over the body. Okay, अब ये लोग म्यूट कैसे होंगे? Okay. So let's talk about heat now. We are going pretty slow because of this beeping sound. I'm really sorry. Let's just amp up a bit. Heat cramps, heat exhaustion, and heat strokes. Okay, so bit up. I'm really sorry. So let's talk about heat cramps now. But these are classically seen in labor workers. Why? Because they are the ones who are working, who are just working in very hot weathers. Okay, so what happens is there's painful spasms of the voluntary muscles, which is mainly because of strenuous exercises or strenuous work under very hot conditions. All right, then comes, okay, what is happening? Then there's heat exhaustion or heat collapse. It's just that you lose consciousness when the body temperature, when you are exposed to very high uh, degrees of temperature, right? So you just lose consciousness or you just collapse. Okay, then the main thing we need to talk about is heat stroke. Now what it is, it's impaired functioning of heat regulating mechanism of our body, right? So the body, it's just, you can think of it as like the body just gives up. There's so high temperature in the environment that the body just gives up on maintaining the core body temperature. All right, so this is what heat stroke is. It's very, now it's not like you need very high degrees of temperature to have a heat stroke. You can even, a person can even have a heat stroke at 32 degrees centigrade, but if the humidity is 100%. So the percentage of humidity plays a very important role in the maintenance of our body temperatures, right? A very high humidity would make us feel warmer, right? So not only the temperature, but the humidity also plays a part. Now, what happens, or what are the symptoms that we can see in a heat stroke? There might be headache, nausea, vomiting, dizziness, weakness in legs. Now, this is something interesting, that there would be excessive desire to masturbate, or there would be frequent urination. So let me, I don't know when will this stop. So let me just call the moderator. Maybe he can help us. And the symptoms that we would encounter would be extreme headache, nausea, vomiting, there would be weakness in legs, there would be excessive urination, and finally there would be loss of consciousness, right? So let's start with the next one. What would be the treatment? Now this is a compiled treatment for heat cramps. You would advise drinking saline water, right? Why does heat cramps occur? It's a loss of electrolytes through excessive sweating that causes heat cramps in our muscles, all right? Okay, so somebody raised a hand. Yes, Abdul Mois. Just a second. हेलो. हाँ, अब सही है, अब सही है. चलिए, थैंक यू. हेलो. Okay, so I guess we're off with this beeping sound, and I hope the sound is very clear to you guys now. So let's move on. For the treatment, we've talked about heat cramps. So basically, why does heat cramp occur? They're because of a loss of electrolytes, excessive loss of electrolytes through sweating, which causes our muscles to cramp. And the only treatment that we need to give is saline water that would replace the lost electrolytes. All right, you can give sedatives to help with pain. Then in cases of heat exhaustion, it's mainly supportive. You can give glucose, saline. You just need to cool down the temperature of the body. That's it. Now in heat strokes, you just need to lower the body temperature. That's the only treatment that you need to give. Okay. Now let's talk about electrocution, which is deaths from electricity. So the source of electricity can be domestic, industrial, or even lightning. All right. There are two types of currents. One is alternating, which just reverses its direction at regular intervals, and then there's a direct current. Now, you just need to remember that alternating current is more dangerous as compared to direct current. Why? Because it causes violent muscular contractions because it's just reversing its direction at every second, and that is responsible for the hold on phenomena. Like the victim is just constantly attached to the source of current, right? That is called a hold on phenomenon. Okay, that increases the duration of contact and also damage. Okay, so there are many factors that are involved in the degree of damage that electricity can have on a body. These factors include voltage, amperage, form of current, resistance of the body, area of the contact of the body, duration of contact, whether there's any earthing or insulation, and also any underlying diseases. All right. So I don't think we need to talk about. Okay. Can you please explain the hold on phenomenon? Okay. Okay. There are two questions. Now, let's talk about the hold on phenomenon for now. Now, what happens is you might have seen in movies or TV dramas probably that the victim is just attached to the electrical source and he just cannot get his hands off the, let's suppose, the switch that he was trying to open. Okay. Now, why does this happen? Why cannot the victim, once he's exposed to the electric current, the alternating electric current, he cannot get off his hand from the switch? Why does this happen? It happens because of muscular contractions. Okay, alternating current is rapidly changing its cycle, right? It's just reversing its direction every now and then, every second. Okay, so what happens is because of this, our muscles get stimulated. Okay, the electric current stimulates our muscles and they contract. And they contract so violently because the time at which the cycle is reversing is like per second. Okay, so what happens is, like, first it's going right, let's suppose it's going right, and then it's going the direction of the current. So our muscles don't get the time to relax, right? First it's going one way, our muscles contract. Then it's going the opposite way, the muscles are contract again. Okay, so the muscles are not having the time to relax. That is why the victim cannot take his hand off the switch. Okay, do you get the hold on phenomenon now? This is what a hold on phenomenon is. The person just literally sticks to the source of electric current. Okay. All right, thank you. Now, who is excessive micturition in heat stroke? All right. So what happens is, in heat stroke, the mechanism of our body that regulates our body temperature just fails, right? What happens because of this is there's very high amount of vasodilation happening in our body, all right? that leads to, sorry, no, excessive micturition. Wait. Now, if we, now, wait. I need to read on this, that why, because at this moment I'm not able to explain why is this happening. Excessive micturition happens in heat strokes. Let's Google this after a while, all right? We'll get back to this question. I'm really sorry I cannot answer it right now. All right, so we were talking about the factors that are involved in the damage caused by electricity. So the voltage, the ampere of the current, form of current, obviously alternating current is more damaging. Resistance of the body. A dry skin offers more resistance, all right? So that is why if there's a very low probability that someone would get a shock if their hands are dry and they're touching an electric source. That is why we say that don't touch these switchboards with your moist or wet hands. Okay, so that's what resistance is. Then there's area of contact of the body. Now, a thick skin, our skin is the first barrier, right? A thick skin, like of the palms and soles, would offer more resistance to the body, whereas thin skin, like for example of any other part, would offer a low resistance. Then there's area of contact. The bigger the area of contact, the higher the damage. Duration of contact, same phenomenon. The higher the duration, the higher the damage. Earthing and insulation plays an important role. If there's insulation there, so obviously the damage will be lower. And obviously presence of any underlying disease would play a very significant contributing factor, as if the body is weak, it won't be able to fight off the damage. Okay, so now you don't need to go in this much of detail, but remember one thing, that for voltages, if there's a medium voltage, right, that would cause a prolonged contact due to induction of spasm of the muscles, and therefore the victim grips and holds on to the conductor. Now, medium voltages would contribute to hold on phenomenon, all right, whereas a very high voltage will not. Okay, it would just throw the person clear away from the source, okay, because of extremely violent muscular contractions. So just remember the difference between medium voltages and high voltages. So a medium voltage source would cause the victim to hold on, whereas a very high voltage would just throw away the victim. All right. So this was the ampere, or it's just intensity of the electric current. That's what an ampere is. So a high voltage current with low ampere would be less dangerous than the one with moderate voltage but with high ampere. Now, in very simple words, ampere is just how intense an electric current is. So obviously, if the intensity is higher, there would be more damage. Okay, we've already talked about why alternating current is more dangerous than direct current. Okay, then resistance of the body, we know that. Area of contact, done. Okay, passage of current through the body. All right, so if the passage of current through the body involves the heart, then there would be immediate cardiac cardiac arrest due to rapid ventricular fibrillations, and that will lead to death. Okay, so if the heart is involved, like for example, if the passage of electricity is from one hand to the other hand, the heart is in between, right? The heart gets involved and there would be immediate death due to ventricular fibrillation. Okay. Then, all right. So causes of death in electrocution are mainly ventricular fibrillation. Okay. Ventricular fibrillation is lethal if not treated. Okay. If you remember from your cardiology, that it's just when the cardiac output gets zero in ventricular fibrillation. There's the heart muscles are fibrillating and they're not producing sufficient contractions to pump out blood, and that causes immediate death. Okay, if not treated. So it can be ventricular fibrillation. There would be respiratory muscle paralysis because of rapid contractions, and there might be some secondary causes as well, like falling from height or head injuries or burns. Okay, just remember ventricular fibrillation as the most important one. And secondly, uh, the tetanic asphyxia or spasm of the respiratory muscles. These are the two main causes of death in electrocution. Okay, refit and respiratory muscle paralysis. Okay, all right. Now, entry and exit points. So, you just need to remember that there would be an entry and exit point, and that would be marked by a electric mark or a burn. Okay, so that's about it. We don't need to do much of a detail here. There's too much detail. For spark burns, there would be just some poor intermittent contact with an electric source, and that would lead to some ulcerations or burning areas. Okay, it would be like a scab may form around, a yellowish parchment like scab may form with a pale halo around it due to capillary contractions. Okay, so then comes flash burns. Now this is important, so we will spend some time here. Flash burns are due to contact with very high voltages, all right, like those high tension lines that are from those what do we call those sources, those big rectangular boxes that you see of K electrics. I don't know what are they called, but those from those are coming the high tension lines. Okay, so they have a very high voltage, and if somebody gets in contact with them, they would experience extreme burns. Okay, they can have all sorts of burns, and there could be a very high degree of damage. There could be discoloration of a large area of skin with burning. There would be pattern of lightning burns. There would be crocodile skin because of multiple burns in multiple areas, right? So these are the most damaging ones. These are because, just remember, for flash burns, these are because of exposure to very high voltages. All right. Then comes the postmortem findings for electrocutions. So for external examination, there would be an entry and an exit point for the electric current. There would be some burns at the entry point. There would be some burns at the exit point, and then face would be pale, eyes congested. These are not that significant. Just remember the entry and exit point burn. Okay. Then comes the internal ones. So organs would be congested. That's it. Not that significant. Now, death can be accidental, homicidal, or even suicidal. All right. Now, this is the last thing that we need to talk about, which is starvation. Deprivation of regular and constant supply of food. All right. This is what starvation is. It can be acute when the food is completely stopped, and it can be chronic where the withdrawal of food was gradual and over a long period of time. So in both of these cases, death can occur, right? So let's talk about the symptoms. In the first 2 days, if somebody has just gone on a hunger strike, what will happen? There would be some hunger pains, or you would have some abdominal pains, which are called hunger pains. There would be intense thirst. Um, Obviously, you're not drinking or eating anything, so you would be thirsty, the face would be pale, mild dry, saliva would be thick. Then a couple of days more pass by, then you would start noticing emaciation, which is loss of weight and loss of subcutaneous fat, right? The muscles would be wasted, cheeks would sink in, face would become wrinkly, okay, pupils are dilated, the lips and tongues would be dry, breath would be offensive. So this is all gradually what's happening over a long period of time. Okay, temperature would be normal, like it would be not much significant here, nothing. Okay, then as you move on with the hunger strike or starvation, the person would appear to be cadaverous. Obviously, when he's just losing his body weight, he would look as if a cadaver, right? Because the subcutaneous fat is lost now, right? Intellect remains clear up to then, so he's going to be perfectly fine psychologically and mentally, but he's just losing weight rapidly, and he might experience convulsions before death. Now, this first constipation, why? Because you're not eating anything, but then are just because of the blockage of the intestines, there's rapid peristalsis, and then there's diarrhea and dysentery, and that causes ultimately death because of further loss of electrolytes and water. Okay, urine becomes scanty. All right, people bury electrocution victims in sand for some time. Is there any medical reason? No medical reason at all. I don't know why they do that. Okay, once the victim has died of electrocution, that's it. He won't have any residual electricity to give off to others, right? No medical reason, Sama. Okay. So, urine would be scanty. So there's nothing that we need to discuss here. Someone who is just starved to death would be emaciated. There would be loss of weight, and there would be less urine. All right. So this is something that you can make out on your own. All right. This is important. Fatal period. Okay, this is something you should remember. Now, if both food and water are stopped, the person may die from anywhere between 10 to 12 days. Now, if water is given with very little quantities of food, the person may survive up to 2 to 3 months, right? And there was a prisoner, Jatindranath Das, all right? He was on a hunger strike and he survived for 61 days, right? So I guess his hunger strike was with water and slight food. So that is why he survived for around 61 days. Okay. So what are the factors that influence death in cases of starvation? Age, obviously. Children and old people are more affected. Then, children are affected soon, and old people can stand starvation better, but not for longer periods. Okay. So basically, both the children and old people are more prone to die with starvation. Okay. Then sex, females stand for a longer period. Why? Because they have greater adipose tissue, more fats, so they can survive more. Condition of body, if they're fat and healthy, they would survive. Environment of the body, that is. All right. So treatment. You're going to start off with liquids, hot water, tea, then you go on towards glucose-rich fruit juices and drinks like milk and fluids, and then you just need to keep the body warm. All right, postmortem appearance is not that important. Obviously, if someone has died of starvation, he would look cadaverous. There would be loss of body fat. He would look emaciated. Eyeballs would be sunken. Okay. So postmortem internal fat is absent. Okay, so Gallbladder is full and distended, omentum is shrunken, stomach is small, okay? It would be empty, mucous membranes of the stomach and then small intestine are less stained with bile. Why? Because he's not eating anything, so bile is not coming out. Okay? Intestines would be empty. So this is self-explanatory. If someone's not eating, his stomach would be small. All right. So in the medical legal aspect, you just need to ask yourself whether it was suicidal, it was homicidal, or accidental, right? Like in mine disasters, people who just are enclosed in a closed space and they cannot get out, they won't have access to food and water and they might die. Then comes homicidal ones. This can only happen with children or very old age people who cannot access their food and water on their own. And suicidal can also happen in cases of hunger strikes. Okay, that's about it. Thank you so much for staying with me to the end. Any questions? Okay, so I guess that's about it. So we can call it off, I guess. All right. So take care.